The White House is signaling the next phase of the pandemic as COVID numbers drop and more Americans get vaccinated. A week ago, the CDC updated guidance on indoor masking, saying most Americans are safe going without a mask in indoor settings, including in schools. Sarah Hammond tells us what the new plan means to you.
A new 96-page COVID response plan from the White House signals we're moving into the next era of the pandemic 2 years after it began.
Thanks to the progress we've made in the past year, COVID-19 no longer need control our lives.
The administration's newly released plan outlines ways to keep serious illnesses in check and prepare for new potential variants.
I can't promise a new variant won't come, but I can promise you we'll do everything within our power to be ready if it does.
The first part of the plan calls for making more free rapid tests available online starting next week, as well as setting up pharmacy clinics that will hand out free antiviral pills to people who test positive.
To provide individuals access to testing and treatment for free, all in one stop. Hundreds of one-stop sites will open across the country this month.
The second major part of the plan is preparing for potential future variants by mass producing 1 billion doses of vaccine each year. That way, a new formula can be delivered within 100 days if there is an aggressive new variant. If they can secure funding, the plan will also include new facilities around the country for people dealing with long COVID. 2 years ago, the country had limited resources to deal with the virus. Now, the Biden administration says altogether, this plan is centered on having enough tools to let Americans safely return to normal activities while still living with COVID. The plan also includes launching a new website where people can see the COVID-19 risk level in their community and specific guidance based on that risk. You can also find vaccination sites and free masks. For 13 News Now, I'm Sarah Hammond.
With new guides and a growing number of tools to fight the virus, how can you calculate your own risk? Well, we asked a pediatrician. She says if you're older than 65 and have underlying health conditions, stick with wearing a mask inside public spaces. If you're young, healthy, and vaccinated but live with people who aren't vaccinated or have underlying conditions, you should also hold on to your mask. If you live alone, you're vaccinated, you're boosted, she says, you can skip wearing the mask indoors.
I don't think we have conquered it. I think that we are controlling it, and the goal is to control it more and more.
While we're past the peak of Omicron and COVID-19 trends are improving across the country, doctors say we should stay on alert for any new variants.